Good morning. Hello, my name is Holly. I will be your nurse today. Can you tell me your name and birthday? My name is Teddy Sawyer. My birthday is September 8th, 1986. Thank you, Mr. Sawyer. So it looks like you're a little dehydrated, so we're going to need to start an IV to give you some fluids. Is that okay? Yes. Okay, this should only take a few minutes and it shouldn't hurt that much at all. So first thing, I'm going to go ahead and wash my hands. I confirm that this is the right patient and he's getting the right fluid at the right time, the right route. I will perform the right documentation when I am done. At the right dose, the right time, yes. Right patient, right medication, right dose, route, time, and documentation. All good to go, hands are washed. I'm going to go ahead and find a good looking vein using my IV start kit that I will set up. So I open this up here. I'll lay it flat. Always good to have extra tape. Here is my itty bitty tubing that I have, along with this. Oops. And get this ready. Stay still. Over here, I'm going to use my tourniquet to find a good vein. A little snug. Palpate. Find one that feels nice and bouncy. Feels good here. So I put on my gloves. And I clean the site. I get my handy dandy needle. Okay, double up, straight on, anchor below, insert, observing for blood in the flashback. It's the catheter off of the needle, take the needle off, throw that away, pop this little catheter, tourniquet off, hold her there. Then we go ahead and get our tubing, taking the lid off, attach it here, and then we flush to begin with, removing the cap, hold that, flush, discard there, attach the tubing here. Oops. Okay, not gonna let this fall out. Take this off. We secure it. Take the plastic off, throw it away, and I write my initials, date, and the gauge. And we are all good with this IV. So next I'm going to give a bolus medicine, which I will begin by first flushing the IV. So I got that out of the way. Actually, I'll wait. I will prepare my medication first. So I take this needle. I take the right medication. Let me first go over my documentation one more time. I have this medication for this patient to be given at this time, by this route, at this dose, and I'll perform the correct documentation when I'm done. So I uncap my needle, and this is the only instance that I would recap. So I first drop the correct amount of air in milliliters that I'm going to need. Insert the air. I flip. Drop the medication. I get all of the air bubbles out. Take off that, ensuring there are no air bubbles. Have the right milliliter. I recap this needle, and I leave her there just for a second. Then I take my first flush for the IV, and I first wipe this off with alcohol. I leave that in a sterile place. And I wipe the port, discard, give the first flush, take that off, discard. I'll take alcohol and again wipe the port before I give the medication. Take off the needle. I give the medication. And I throw that in the sharps. I wipe it again with alcohol one more time. And I give the second bolus at the same time that I would have given the medication. So, here I have already wiped it with alcohol. And I give the second bolus at the same time that I give the medication of the bolus. And I disconnect, wipe again with alcohol, and reattach the IV line. And that is how you give an IV bolus medication. So next, my patient needs a subcutaneous injection. I confirm that this is the right patient and the right medication given the right route, dose, and time, and I'll perform the right documentation when I'm done. So here we have our heparin injection all ready. So I'm going to turn my patient over and give it in some subcutaneous tissue. I cleanse with alcohol, and I uncap the needle, and pinching a little bit of the fat here, insert just below the skin, 45 degrees, give all of the medicine, apply a band-aid over, and some pressure. So there's 3 skills. Then I take off my gloves, discard, wash the hands, make sure the patient is comfy, and throw away all of the materials that I don't need.